We present our technique of a single-stage arthroscopic cartilage repair of the patella with minced cartilage and implantation of a templated membrane collagen scaffold with BMAC augmentation. These are our disclosures. Bone marrow is harvested from the patient's ipsilateral proximal tibia using the Zimmer Biomet BioQ and subsequently concentrated with the GPS-3 centrifuge system. The BMAC solution is then instilled into the chondral guide sheet and left to soak for 5 minutes before being cut to size with a 15-blade and atraumatic forceps. For the debridement and preparation of the articular lesion, we utilize a chondrectome extended set for large joints manufactured by BioVico. For the collection of minced cartilage, we utilize the graft neck collector system manufactured by Arthrex.
The collector has a filter chamber which collects the chondral fragments. The minced cartilage is placed in a sterile dish, and about 3 drops of BMAC are added to form a cartilage paste. The paste is loaded into an application cannula and pushed to the tip using the trocar of the cannula.
Here we demonstrate an arthroscopic view of a cartilage defect on the medial facet of the patella that is soft on probing. Debridement is commenced with a curette, which can be inserted through the medial patella accessory portal to allow for better access to the lesion. Chondrectomes are also used to create clean lesion margins. The surgical assistant holds the arthroscope, and the surgeon holds the patella with his free hand, and this manual control of the patella allows for tactile feedback when scraping the patella down to the tight mark. Adequate debridement depth is indicated by characteristic punctate bleeding from the subchondral bone. Curved respiratory is used to template the defect for the collagen scaffold. A 4mm bone shaver is used in forward mode to harvest minced cartilage from known weight-bearing areas. Cartilage is also harvested from the femoral trochlear. The procedure is converted to a dry arthroscopy with a medical sucker tip and arthroscope skid used to purge normal saline as well as to push any synovium that would impede visualization. Tissue glue is applied to the base of the lesion and left to harden for 1 minute. A needle applicator is used to apply the minced cartilage to the lesion. A layer of tissue glue is applied on top of the minced cartilage. A McDonald's is used to mold the minced cartilage and the glue into the defect. The BMAC soaked collagen membrane scaffold is then carefully introduced to the working field. The graft is gently grasped on the articular surface apex with a pair of artery forceps and guided into place. A layer of tissue glue is added to seal the scaffold into place. The graft is then tamped and molded into place with the curved respiratory tool. A final layer of tissue glue is added with molding of the patch to be sited within the defect and left to dry for 5 minutes. The knee is then taken through the full passive range of motion to evaluate the stability of the implanted scaffold for 10 repetitions, and we re-evaluate the stability of the graft under direct arthroscopic visualization afterwards.